This isn't a debate about natural versus pharmaceutical. It's about whether you're building strength or masking symptoms. Because if you have type 2 diabetes, ultimately you're either rebuilding your metabolism or you're watching it rust while the meds pretend everything's okay. Now, if you're okay with that, keep taking metformin without question. But if that's raising some red flags, then this video is for you. My name is Dr. Adam. I help men reverse type 2 diabetes by doing the opposite of what most doctors recommend. So instead of obsessing over low carbs and fat loss, I focus on muscle growth, insulin sensitivity, and then real metabolic flexibility. Look, metformin isn't evil. It's a tool. But if you're not careful, like most meds, it becomes a crutch. So if you're taking it or thinking about taking it and something feels off, keep watching because metformin might be making you feel worse. And nobody's probably telling you why. So let's start here. Every single person I've ever met with type 2 diabetes has been prescribed metformin. Let that sink in. It's pretty wild, right? What a monopoly. Not most, not many, every single one. Why is that? How is that possible? Well, it's because it's cheap, for one, plus it's standard of care, and it's what doctors reach for when their patient isn't willing or ready to make changes. So this is how I think about it. Metformin is a pharmaceutical insurance policy against inaction. And here's what I mean. The healthcare system says you're probably not going to fix your diet. You're probably not going to strength train to build muscle. So here's a drug to slow the decay from diabetes. It's a crazy system. But here's what I think that you need to know. When you agree to go that route, the medication as the primary treatment route, you're not managing diabetes. You're slowing the decay that it causes. And if you're already accepted that, if you're fine being on meds for the rest of your life, that's fine. You can click away. But if that's not the future that you want, then listen up because here's how metformin works. First, it reduces how much glucose that your liver dumps into your bloodstream overnight. It also slightly improves insulin sensitivity, and it slows glucose absorption in the gut, which all sounds useful, right? But here's a trap. If your fasting glucose looks better in the morning, you're assuming you're improving. But are you? Because you're probably still insulin resistant, you're probably still overeating carbs, and most likely you're probably still sedentary, which tells me you're just muting the alarm. The fire's still burning. You just took the 9-volt battery out of the smoke detector. But here's the pattern that I see often. A man gets diagnosed with prediabetes. So let's say his A1C is 6.2%, fasting glucose is 120. His doctor tells him, well, you got to eat better, you got to move more, which we all know at this point is medical code for I don't have the time to coach you or warn you about what's coming. I'm talking about fatigue and erectile dysfunction. And then 6 months go by. The guy doesn't change. At least he doesn't change enough. And it gets worse because that's what happens. So now his A1C is 6.5%. So he's crossed the technical threshold. So now it's officially type 2 diabetes. And then boom, metformin, 500 milligrams every time. But this guy keeps eating cereal and corn tortillas. He works out every other week. Maybe he cuts out soda, maybe not. And because his numbers look, not as bad after he started the metformin, he convinces himself that he's improving. Well, this is the false sense of security that keeps men stuck, especially if he's lying to himself and saying, well, I'm eating better while still reaching for chips at night, right? Now, let's talk side effects. They don't call it metfartmin or metformin rumble for nothing, because up to 30% of people who take metformin experience bloating and diarrhea and cramping, gas, nausea. But that's, to me, it's uncomfortable. But that's not even the worst part, because metformin also blocks vitamin B12 absorption, which is a problem if you like the way your brain works, because low B12 leads to nerve damage and brain fog and low mood and poor energy. Ultimately, it reduces testosterone production. So now you're insulin resistant, your testosterone's dropping, your gut is inflamed, and you're exhausted. And your doctor's answer is, well, try taking it with food. Here's another hidden landmine. Metformin works best at night, again, because it suppresses that liver glucose production while you sleep. But most men eat their worst meals and the worst food between 6 and 11 p.m. That's the classic danger zone. That's when chips and pasta and ice cream and beer, that's when it all comes out. I mean, even for me, I know that if I don't brush my teeth after dinner, I'll inevitably start looking for a snack around 8 p.m. Well, metformin lets you get away with that, at least for a little while. You wake up, check your fasting glucose, and it's 30 points lower. And your doctor cheers and says, look at the progress. But what he's not checking is your fasting insulin, which is probably 30% higher. And remember, insulin resistance, not blood sugar, is the root cause of type 2 diabetes. So unfortunately, you're not improving. You're sedating the signal. Now, here's what really bugs me about metformin. Let's say you finally decide to strength train. So you're lifting weights or using some form of bands, you're eating protein, you're building muscle, thank God. But if you're taking metformin, you're at a high risk of blunting those results. There's a study from Aging Cell in 2019 that showed that older adults who took metformin while lifting weights gained less muscle and less strength than those who didn't take it. I put a link below so you could read it for yourself. So what's happening there? Well, from my understanding, it's because metformin interferes with mitochondrial adaptations. Translation, your engine doesn't upgrade. Your recovery is worse. Your strength progress is diluted. And that sucks because muscle is your number one metabolic engine. If you're trying to reverse type 2 diabetes, this is the one thing that you cannot afford to compromise. But metformin, unfortunately, interferes with that progress. So you might be wondering, why is it prescribed to almost everyone? Well, because it's what we're taught to do. Metformin is the default for patients who aren't ready to make the hard changes. What most people don't know, however, is that your doctor's job is just to reduce your risk, not rebuild your health. They're not trained to coach you on behavior change and muscle building and meal prep. So what does that leave them with? Well, unfortunately, it's a classic playbook. Step 1, prescribe metformin. Step 2, add more drugs to the mix. Step 3, eventually insulin. And then they'll call it management, but all you're really doing is managing the speed of the decline. But if you want to stop the slide and actually fight back, here's what works. It's 6 key things that I do with every one of my clients. Number 1, track your blood sugar. Use a CGM. Know your numbers. Number 2, like I say in every single video, build muscle. Do some form of resistance training 3 times a week, period. Number 3, walk after meals. We're just talking 10 to 15 minutes, especially at night. Number 4, prioritize protein. It's a lot, but ideally it's close to 1 gram per pound of your goal body weight. And then cut liquid sugar and refined carbs. So no grains, no potatoes, no rice. And then finally, fix your sleep. No excuses. And now, as you can see, this isn't complicated. It's just uncomfortable, but it works. And look, if you're a guy over 40, if you're tired, if you're overweight, and you're worried about all this, I get it. You probably sacrificed your health for your career or your family. And then no one showed you how to update your training based on where you are now. It's not how you were training in your 20s. If you're stuck in management mode, it's not your fault, but it is your problem to fix. So this isn't about blame. It's about taking ownership of this. Because if you don't take control, man, I'm telling you, the system will put you on meds and then more meds and then eventually injections. I mean, the average guy I work with is on 4 different pills when we start. And that number tends to only increase if they stay on the path. And what's alarming about that is, meanwhile, despite being on the medications, your kidneys are still at risk. Your nerves are still dying. Your legs still go numb and you still get ED, despite taking those 4+ pills. But that's the path, at least until you start fighting back. So here's the hard truth. Metformin doesn't fix the fire. It just hides the smoke. And right now, maybe after listening to this, you're a little fired up. Maybe you're annoyed. Maybe you want to quit these drugs cold turkey, but don't. That's not how you win either. Tapering off is the answer. But, and this is key, tapering off is the only answer when you're ready to replace the pill with real action. Ultimately, if you have diabetes, you still need medicine. So it can be diet and movement and cold exposure and fasting and muscle, or it can be pills. But you have to choose your hard, because the easy path of taking pills isn't actually that easy. It's just quick and it doesn't force change up front. But eventually, your easy becomes a life full of prescriptions, and side effects, and then Metformin rumbles, which isn't exactly easy either. So, if you're ready to stop managing decay and actually rebuild your body, watch this next video. I break down the exact plan I use with my clients to reverse type 2 diabetes without meds. Or you could book a call with me. We'll build a sustainable plan together because at the end of the day, medication might keep you alive, but it won't make you strong. And that's the goal. All right, let's get to work.